5 falsehoods that are causing harm to individuals with diabetes. Without exaggeration, because many falsehoods result in multiple deaths of diabetics, as they believe in myths, in completely distorted things, which lead to a deterioration of treatment, to extremely serious consequences. The initial falsehood that is causing harm to individuals with diabetes, which is extensively propagated on the internet, is the notion that individuals with diabetes must consume lard or animal fat as an illustration. Hey guys, this specific type of fat, known as saturated fat, has the potential to increase your cholesterol levels, particularly the harmful LDL cholesterol. So it is not a type of healthy fat, because as a diabetic you are not allowed to consume animal fat, such as fatty meat for example, due to its adverse effects on your health. When cooking, you will use pork lard. You will make an egg and fry it in pork lard for a healthier option. I don't understand why so many people believe in the health benefits of pork lard. In reality, pork lard is not a healthy choice. However, I do know someone who used pork lard and lived a very healthy life. It's important not to generalize based on exceptions. Don't believe that using pork lard is always bad. What about trying an egg? Prepare a boiled egg. Alternatively, grab a non-stick frying pan and cook an egg without adding a spoonful of lard. It will be significantly more beneficial for you, because in addition to the food, you are acquiring saturated fat from lard. Alternatively, a fatty animal meat, bacon, is not permitted. The fact that bacon does not cause a significant increase in blood sugar immediately after consumption does not justify its allowance for diabetics. Bacon is high in calories, which can lead to an excess intake, worsen insulin resistance, and contribute to an increase in bad cholesterol, LDL. The notion that cholesterol is beneficial for diabetics is another misconception. Cholesterol is beneficial, but it should be maintained at optimal levels for hormone production, cells, and overall body health. So excess cholesterol is very harmful. And what is the main cause of death in diabetics? Cardiovascular diseases, heart attack, stroke are serious health conditions. So you have to be careful with cholesterol. And diabetics have to be even more careful because diabetes is a risk factor. And individuals who do not have diabetes may even possess cholesterol, often slightly higher. However, those who have high levels of sugar in the blood, high blood sugar, must be extremely cautious with this. What is the reason? High levels of blood sugar ultimately result in harm to the blood vessels. And when it's painful, often the cholesterol goes there and deposits in that wound, in a very simple way for you to understand, and ends up forming the plaques, which are the so-called atherosclerosis. So the person with diabetes must they must have even lower levels of cholesterol, even lower, for you to understand that this is a significant falsehood, okay? So forget about that story. Pork lard, bacon, butter. The second lie that also kills many diabetics is that hypoglycemia, low blood sugar, is normal or even beneficial for diabetics. When in reality, levels that are lower than 70, low blood sugar that is defined by levels that are lower than 70, can be extremely harmful to individuals with diabetes. It is never normal. Always have to be corrected. Always have to look for the cause, why it happened, so as not to run the risk of hypoglycemia. And what is this risk? There are two risks that we aim to avoid in the condition of hypoglycemia. The primary risk is that in order to try to compensate for this, to try to increase blood sugar levels once again, the body will produce adrenaline, will produce cortisol, will produce hormones that will modify this particular situation and potentially exacerbate the underlying issue. And when you produce a large amount of adrenaline, what occurs? The heart beats at a faster rate, tremors, cold sweat, and pain. This is harmful to your health. Many patients at this moment of hypoglycemia end up having a heart attack because the heart has to exert a lot of effort. They ultimately experience a stroke due to these changes occurring in our body. Therefore, hypoglycemia is always abnormal. If you have hypoglycemia, always write it down, relate it to something, take to the doctor at appointment so he can see if he needs to modify treatment. However, there was a specific day when I fasted, when I was traveling. Well, in this particular case, it was only once. Now, frequently I attend to individuals with diabetes who experience multiple episodes of high blood sugar levels every week, and they are unaware of the underlying cause. That is extremely detrimental. And the second aspect remains excessively low blood sugar in the condition of hypoglycemia is that over the course of time, your body will, in quotation marks, become accustomed to this hypoglycemia, and you will experience symptoms with progressively lower levels of blood sugar, which is also hazardous. It has happened that patients in a hypoglycemic crisis go into a coma, have seizures, and also sometimes the patient doesn't feel anything. They are there with 45, 50. This also needs to be looked at in a better way. The third lie that also kills diabetics is that fruits are forbidden. I don't know who invented this. It must be the same person who said that lard is good and fruits are bad. Do you know who invented this? Put it in the comments. I really want to know. I need to know. Because everything is the opposite. It's like reversing diabetes. Everything that is good will now be bad, and what is bad will be good. So fruits are excellent for individuals with diabetes. You not just can, but should consume them. The question here is that fruits that have a certain amount of sugar, carbohydrates, and also have a higher glycemic index, what is that? When you eat, how much will that fruit increase your blood sugar? So fruits with a high glycemic index and high glycemic load should be avoided, like banana, for example, grapes themselves. These fruits you will avoid. Now, there are multiple fruits that are beneficial for individuals with diabetes, like guava, avocado, strawberry, cherries themselves, and apple is an outstanding choice. You have to make a wise choice. You have to have some knowledge. I have already made a video about it. I will leave the recommendation for you to watch later, where I explain everything in detail, which are the best and worst fruits. But know that if you don't eat fruits, vegetables, you will have malnutrition. You will lack nutrients if you only eat these fats that people recommend. So be aware that you need to eat fruits that are good for your health. The fourth lie that also causes a lot of harm to diabetics is about the symptoms. I've heard this misinformation many times. I have no symptoms, so I don't have diabetes. Or I have diabetes and I'm feeling very well, so the disease is well controlled. Two big lies, because often diabetes will not give any kind of symptom. When undergoing the treatment, it is common to not experience any sensations. Additionally, it is important to schedule regular checkups and keep track of your progress to stay informed. Often, asymptomatic individuals not always imply well-controlled disease, you know? On multiple occasions, I encounter patients with elevated blood sugar levels, such as 200, 220, and 180. They are feeling very well, and I end up giving the diagnosis, and then I hear that, but I don't feel anything. Could the test be wrong? Always in diabetes, to give the diagnosis, we have to repeat twice, and then comes the confirmation. So truly understand that just because you are feeling good doesn't imply that you have to take tests. Agreed? This is also a widely spread falsehood. And falsehood number 5. And this one is also widely told here. I always inquire about it in the comments section. Is it true that there is such a supplement that can improve diabetes? Or if I make a tea with the peel of a fruit that I don't know, they inform me affirmatively. No type of supplement or any kind of fruit peel or any combination of elements can cure diabetes. This is completely untrue. When it comes to managing diabetes, there are numerous tasks that need to be carried out over the course of several days, involving a variety of steps that must be followed in order to successfully control and achieve optimal blood sugar levels. So these advertisements, these false promises, miracles that appear, be aware that they do not exist. I have seen many times, but this is a conspiracy. All healthcare professionals gather from time to time not to disclose the secret. So all nurses, nursing technicians, doctors, pharmacists, all of them have knowledge, but they don't disclose it because the industry is like this and like that. Guys, this doesn't exist. It's a conspiracy theory, okay? Of course, we know that not all professionals are completely correct, but there are numerous professionals who are accurate. Most doctors I know have no alliances, receive no money from pharma industry. For example, you know I have no hidden agenda. I always state, I do not receive funds from any pharmacy, from any industry, specifically to possess the freedom to communicate with you in this manner. From 0 to 10, what grade do you give to this video? Do you remember when I talked about the fruits? What are the best and worst fruits? In this video here, I talk to you and explain why, so you can understand. And there's another video where I talked about 12 tips for you to better control diabetes without a magic formula. Do you want to know? In this video here, I also talk about it. Thanks, a hug, see you next time.